Thank you very much for giving us the opportunity to provide opening remarks. Today we'll talk about how we manage heart diseases and how to live healthy with it. We would like to acknowledge that our iCON office is situated on the traditional, ancestral, unceded territory of Musqueam, Squamish, Teslevatlat peoples. I would also like to acknowledge that you're joining us today from many places, near and far, and acknowledging the traditional owners and caretakers of those lands. And I will ask Ripujit to tell us about her. My name is Ripujit Karandava. I belong to city of Bathinda, but I was born in city of Faridkot. I did MBBS from Ludhiana, then MD anatomy from Amritsar. With that, I'm connected to Panjabi culture, and I joined the dance, Gidda, Uli, and Pangra teams of the college and MC College. With my education, I joined culture programs and I also joined conferences and as well. And I was attached to different forums. Thank you. Let me tell you something about myself. My name is Lean, and with iCON for 6-7 years. Other than joining iCON, I'm pharmacy specialist in medicine, and my purpose of today with iCON is that you understand about your health, about your rights, so you know about those, so you can get information about your health. You can get all the information today so that you can take care of your health in future. What is iCON? iCON is Intercultural Health Network. It's with the University of British Columbia with the digital emergency medicine. With iCON, Ministry of Health also supports iCON, and they are partners with it. Why iCON does this programs? To assist multicultural and indigenous citizens, patients, and caregivers. If it is you or your family member, or your healthcare team, your doctors, pharmacists, dietitians, or your physiotherapist, occupational therapist, any team members that assist you, so you can get information about that. So our focus is to optimize chronic disease prevention and self-management. There are many examples of chronic diseases like hypertension, blood pressure going up, diabetes. You can also call it blood sugar. And these are just examples of some chronic disease. The chronic disease, why they are so important? Because sometimes they are with us for so many years, sometimes we don't know how they will affect our health for longer years. Sometimes we have it for so many years and we don't have any problem. Sometimes you have blood pressure, and for many years those can occur, and it can affect your heart, and it can affect your brain and your kidneys. It can affect your kidneys as well. So about all that we will talk, and we wish to talk about those so you can get all information about those subjects. We also want you to know if you want to get some information online, if you read anything online, then you should know what you're reading, it is reliable or not. We also want to tell you that today. We also want to tell you the professionals, the specialists that we have today, you can talk to them today.
Proceeding ahead, I will present Vineet Kaur on the stage, who is a registered dietitian. She completed all her education, University of British Columbia and Manitoba University. Vineet will present her viewpoint about the diet, that it shouldn't be only tasty but healthy. I have eaten her food prepared by her. N- uh, the diet is not only tasty but also healthy. So, Vineet, come to the stage. Thank you, everyone. Hello, everyone. I am Vineet Kaur. I'm a registered dietitian. I hope your interest in healthy diet, it should be more than just the clapping. I I was brought up in a Panjabi family. My family was in Punjab before, and in last 20 years, we are residing in Canada now. And during that time, we in our lifestyle, we made changes in our lifestyle and diet, and we have not a very good diet over there. I understand all that. That's why I I went into neuroscience education. We have so much scientific evidence and information why we have so many illnesses in our community after. So I studied in nutrition after that because I was curious about this. So uh, towards diet, I used to hear maybe the Punjabi diet is not for our health, whether it's good for our health or not. So there was a lot of confusion on that, for myself in our community. So that's why it's ve- it's my pleasure today. So we all are together here. So we are talking about Punjabi heart health today to discuss about that. So today we will learn today. The learning objectives are how can eating better improve our heart health, tips for preparing heart healthy food, how to buy heart healthy groceries on a budget, and in the last, when we go to the events, weddings over there, how we can maintain heart healthy diet over there, and we will talk about that later. So there is no doubt in that for a for a healthy and eating a healthy and balanced diet is one of the most important things. So when we talk about that, a, he- a healthy diet, what is the purpose? What was the effect? The diet should improve our cholesterol, improve our blood pressure, improve our blood sugar. So the we know how important heart is to our body because it's a pump since our birth to our death, that always pumping our blood to each and every organ and cell in our body. If that there is a change in that blood, if it's thickened, so or our blood vessels narrow down, then load and affect it will affect our heart. That's why we know the illness we talked about this morning. If we want to lessen the load on our heart and we want a healthy diet, and how it affects our blood is very important topic. So these three things we will proceed. In Canada, there is a model that's prepared about the balanced diet, and we say it Canada Food Guide. We call it Canada Food Guide, and there are directions there that we can in our lifestyle. So we just can look at our plate and it can direct us the plate or our diet. Is it balanced? And why it's not balanced? What are the causes and how we can make it balanced? It's a very powerful model. So we will talk about that model. The first direction is the plate you have. Even if you are eating food or snack, try half a plate with every meal should be full with the vegetable and fruits. And then people say me, we only eat lentils and bread. So where can we bring the half plate? You try whatever you are eating right now. So we should add fruit and vegetables in that. You can add coriander, cucumber, um, lemon, fenugreek, spinach, and we can put it in yogurt, and we can have chutney. You can is easily add can be added to the Punjabi food. It's easy. The second thing, when we buy these things, because half a plate is a lot of fruits and vegetables, just seasonal fruits and vegetables we should buy, because we can buy. If you go to Punjab, you will get spinach, carrots, cauliflower. We eat seasonal. w- Yeah, so we should eat seasonal fruits, food. It's easier. And the second thing is frozen fruit and vegetables we can buy here. They have the same type of nutrition, carrots, cauliflower. So, but just be careful that they shouldn't have more salt and sugar, and they shouldn't be filled with more sugar, and they're cheaper, and we can always freeze them. And if we don't have a fresh vegetable, we can use the frozen one at that time. But you should be careful. Canned vegetables, canned spinach. Sometimes um, we buy frozen canned, so we should avoid that because they will make our diet unbalanced. Dried vegetables and fruit like dates, um, raisins, we can make our diet nutritious. The second thing from Canadian Food Guide is about greens. So we came from Punjab. We we are familiar with green. That's what we got it from beginning in India because of colonization, and since we came here, the variety we used to eat, we used to eat millet, corn, bread, not only wheat, whatever things were grown up there, then we were used to eat them. So because of that reason, grains, the the because that takes long to ripe, we consider them healthy. We can bring those grains in our diet, and we should try when we cook this grain. We should only use water. If we use oil, butter, or salt, then our diet becomes unbalanced. The third thing is protein. So because of in our diet, we use plant-based protein. There is lot of is present in abundance and is tasty. Like we have chickpeas, kidney beans, and because it has lot of fiber, and cholesterol and fat is not present, so it helps to manage our cholesterol. These lentils and vegetable in our international from it's out of Punjabi cuisine and became international cuisine. It's usually present in our diet. So you can make lentil soup. You can make salad with the black peas. You can add onions, coriander. You can enjoy, or you can roast them. You can make it a snack by roasting them. You can add it in the flour, and you can eat it that way. The fourth direction for a healthy diet, we will talk about fats. There are two type of fats. There is unsaturated fat that is that may improve our heart health. If you wanna recognize these kind of fats, anything that's liquid at the room temperature, so it's all oils. It's the oil coming from nuts, avocado, peanut, walnut, almonds, cashew, and oil from and the fish oil. So it's very good for the heart health. Just be careful whenever you buy nuts. It should they should be unsalted and unsweetened. If you buy peanuts, no, they shouldn't be salted and they should be roasted. So the biggest thing here is when we use oil to fry. So there are a lot of types of oils in the market. I usually hear most here. I most the most of the time the question comes which oil we should use, Vaneet. You can ask me question answer at the end, but we don't have time. If we wanna keep in mind, if you fry something in once in that oil, don't use that oil again, because when you do that, there is a lot of trans fats in that oil that are very risky for us. Can Health Canada banned that oil to use in factories and restaurants. So we have to be careful if we fry something at home, and then don't use that oil again. Now we are talking about a balance in diet. So in your mind, you can think about the balance in your mind, whatever we talked about today. Like half plate should be and the vegetables and fruits, and then plant-based fat and plant-based protein, and then these things lack in our Punjabi diet. So we should add these things to our diet and balance it. Sometimes in our diet, these are the things that are present more in our diet. We're not gonna cut it down, but we're gonna only lessen it in our diet to make it healthy and balanced. So we will talk about that now. That we should the one we're gonna reduce it from our plate, saturated fats. How we recognize saturated fats? These are the things. They are fatty meats, right? Or in our dairy, in our milk. So don't use um, milk that's 2% more than in fat, like butter, buttermilk, cream, paneer, and cheese. So we have to be careful while using it. So maybe once or twice in a week. So we should use it very less in a. The second thing is the oils. The even some oils are even fluid on the room temperature. They have rich in saturated fat. It's coconut oil or some in canned. So coconut oil has a lot of saturated fat in it. So that's not good for our health. So don't use processed foods. So avoid them and be careful while buying, and look at the label how many ingredients in there, and just use plant-based protein. And we have to ensure how if they don't have how much unsaturated fat in there. The other thing we wanna limit the intake is salt. So the directions we should take from the Canada Food Guide, maybe in a whole day we can only have one teaspoon of salt. So we can abide by it if we is cook at home, but if we buy food from outside or canned food, then the amount of sodium is very big on that. So we have to be careful and avoid all these things. We should read the labels. And the last thing is sugar intake. We already heard how it affects our heart. So we have to be very careful whenever we are buying something. It's already made, pre-made thing. There is a lot of sugar in those things. So please read your labels and then see how much sugar is present in that. And secondly, we think juice is very healthy for us, but if you wanna eat fruit, eat the whole fruit instead of drinking juice, and even eat cereals with lower amounts of sugar. There is a lot of sugar in the cereals, so be careful when you are eating cereals. So we talk a lot, so we don't have enough time. So and the key points are in our Punjabi diet. Yeah, how we can make it balanced. First of all, we should eat more fruits and vegetables, cook meals at home, and it's very good for heart health. And the third is avoid processed and pre-packaged food. So quickly, so we will be talking about the directions. If you are dining out, if you are eating the food that's already cooked for you, how you can be careful about that. So healthy plate model we talked about. If you are going on an event or wedding, or so there's a very good opportunity for us over and just fill up your plate with the vegetables and fruit or roasted. So stuff which doesn't have too much oil in it, and one by fourth, you you choose um, a meat or fish paneer which is roasted in a tandoor or grilled, and the quantity, it should be one by fourth in your plate, so we can ensure that our plate is balanced and healthy. And the last I want to say, the Punjabi diet, it could be very good for our heart health if we bring a balance to it, because in Punjabi diet there are changes, a lot of changes in last 3 or 4 decades. So we should make it balanced. We need to bring the balance back. So look, we should look at this plate model. And thank you very much for listening to me with a lot of attention. Thank you.
Thank you very much, Vineet. As you know, we all Punjabis, we spend all our life around food. And if we can implement your tricks and tips to follow a healthy diet, we should try that.
Dr. Chima, first question for you. The question is, the medication are given after the heart operation. How is linked with the dementia or the or Alzheimer? The medications that are given after the heart operation, is it linked? Is it linked with the dementia or forgetfulness? No, there is no link. If you are already have early dementia or depression, then it could happen. So we are all are in confusion. the blood in our body, cholesterol, sugar, or the other things that those things that are reason for stroke or heart attack is not only affect the heart but it affect the whole body. So overall you have to manage your health in this country or any other place. There is no doctor who can prescribe the medication that could be that could damage your health. So take care of your health. Yes, is healthy approach is very important. There was there are billions of people who don't have doctor, they are managing, so you can manage. We are depending too much on the system or on the on the doctor, and that's damaging. The next question is for Kashmir ji. The question is, if there is so too much stress, so how it affects the heart. In the presentation we agreed whatever we think, it affects the whole body. When we are stressed out, we know on our heart and other organs get affected. There is a connection. So we also talk about what we can do to manage our life more. So if we change few things in our life, we can slow down our life. Or if there is a issue, we can go talk to someone, and it really makes a difference. Thank you. Next question is for Vineet. This question came many times. How many times we can have tea during day? Okay, because the answer to this is lengthy. So please give me that much time, and if I go over, let me know. People who don't know what is a registered dietitian, I tell for their information, registered dietitian. They are part of Canadian healthcare team, and our training, our education is different. It's about holistic health and diet, how they are linked to each other, how they're connected. That's our expertise in healthcare. If your questions are related to that or any diet, then you can talk to the dietitians. Dietitians are present in public health. With the healthcare department, they work with them or privately. So you can talk to dietitian, because how much tea you can drink, it depends what you put in the tea, how much what percentage of milk you are using for your tea, how much sugar you are putting in, it depends on that. Other than that, our science, it doesn't consider tea a bad thing, but if we are having it several times a day, so what material, what things is replacing our diet, so that will affect our health. What tea is replacing in our diet? If you're drinking 2 to 3 cups a day during in the morning and didn't eat breakfast, so the balance in your diet cannot be achieved because you missed a meal. Sometimes we drink tea and miss the meal. That will affect your health more. That's why the question how many times you can drink tea, the answer varies depending on your lifestyle, age, diet. But if you want a short answer, I would say that the tea in our culture, we only drink that time when we sit down and we speak from our heart. We share our things. If you have chances, if you are getting chances just to lighten your heart, talking about things, then. But if you are drinking tea because your life is so fast and you cannot avoid it, then the other things like energy, nutrition, sleep, health, You should be careful about that before talking about tea or decreasing the amount of tea. I hopefully I answered your question. The talking about tea, do read the history about tea, 150 years old. People, countries, people drink tea. It's not an issue. It's a kind of antioxidant in the body. But we shouldn't we talk about that. But the addition we make, sugar and milk you put in the tea, that's the one. If there is issue about intestines or stomach ulcer or something, but avoid the hard, like the one is very much boiled, and avoid that. But if you take tea 2 3 times, it's a social kind of thing too. If you are read the Indian Punjabi history, the colon cancer was very rare because everything was diet based. So don't worry that much about tea. The main issue is everything else we do. Yeah, how much you are eating, what you do, how if you eat laddus, gulab jamun with the tea, barfi, and then you bring pinni in then the relatives are here. We're not gonna stop them from eating. In Surrey, where we are living, look at the shops. Whatever, did you ever ask what you put in these sweets? Did you ever ask? Go ask them. It's not about only tea. How how many calories in one rasgulla? 350. In one gulab jamun, 300 calories. Do exercise, walk, but if you eat two laddus, it's all gone in the drain. So these are the practical things. We are very simple people. So we should be straightforward. No excessive amount of money is also dangerous. One thing you need to remember is whatever restaurant you go to and eat food, I'm sure Vineet will agree with me. Do go see their kitchen, how much is clean, how much they are frying the pakoras in that oil. So all those things very important, crucial. So your doctor, your dietitian is all the specialists, whatever they're doing, do because you are not managing your diet, it goes into drain. Whatever work your healthcare professionals do for you. Look, it's not that we are thinking that there is a profession. You come to my office, if my it's not clean. So if you are going to a restaurant, have the it's not clean, how you can manage? You go if you go to somebody's house, the washroom is not right, or it's not good hygiene, is smelling. It's not the you have to protect yourself. It's not about that person's personality or anything. Not that anything that's available and you eat it. You are paying for it. You tell them, you ask them, they will be embarrassed about that. Like, wow, how you make the sweets? Look, acid is important for the body in our saliva. It's very important for the absorption. We cannot stop it, but how you manage it, it depends on your aztec food, citrus fruits, oranges, all these categories. Avoid them, reduce it. I missed the talk. You should eat whatever is comes in your fist. Yeah, eat according to time. The SAT. Our people are in a lot of confusion. It's only our diet that's responsible, and where we came from. There is a bacteria in the water. It it sits in our body and it gives us so much. I don't have time to talk about that because I was late. I didn't hear the whole conversation, whole talk. control your eyes and your hand, and you will have a good health. I request to those people who send the questions in the morning, they are waiting for it. And if you can, I can please ask those questions. It's from the morning, this question. Silent heart attack. What is heart attack? There are blood vessels, there is valves, nerves. Why we feel pain? When the blood is not reaching to heart, the muscles start shrinking. So that's why you feel pain. Silent attack is when our nerves are not working. Because you are diabetic for a long time and you don't know if you actually have a problem or not. The common presentation is not a chest pain that we feel problem, shortness of breath while walk. While I go upstairs, I feel shortness of breath. Then you don't know silently is there is a problem going on in the heart. Silent means you don't know what is going on in your body. Diabetic patients, people who are with high blood pressure, with high cholesterol, whenever you feel shortness of breath, whenever you feel shortness of breath, meet your doctor, get the test done before we do where we're doing ECG. There is no point. Just go for a stress test, go for a scan, and then there is a confirmatory test, angiogram. It's called angiogram. There is no point of going beating the bush. The thing is, if you have excessive cholesterol, excessive sugar, excessive body weight, and if you have problem, then this is silent attack. When you don't know, it's not a magic. It's our body. Its presentation is like that it will not let you know. Next question. There are two questions. One question is, yeah, the cashew, walnuts, triglycerides are more. Is it damaging? If one person is eating one egg per day, is there an issue regarding the cholesterol? And there is a myth about this question. Nuts, triglycerides. There are no triglycerides in the nuts. Triglycerides are in our body. There are things that increase those, and there are things that reduce. If we eat sugary food, anything we eat with sugar, then if you eat the peanuts that are coated with honey or sugar, then we have to be careful with the glycerides. If you wanna lower your triglyceride, then consult the guide. Then eat nuts. HDL are present and they will help you to reduce your triglycerides. But how much? Whatever, that's the handful, like in your fist, and like not like we are eating cashew burfi, dry roasted without sugar, without salt. 4 5 almonds or cashew or walnuts. So these kind of things you can eat. The second question is about the eggs. Before there was a myth that the eggs have cholesterol, but the new science and evidence is you can eat eggs. That's what it says. Though you don't have to worry about your cholesterol, like how much eggs you eat. So maybe one egg a day, 7 eggs per week is moderate, and you can eat it. The next question is for Kashmir ji. If you want to see a counselor, how we can see a counselor? Do we have to go to doctor, or how we can see a counselor? Is it free to see the counselor? You online, you can go online. BCACC, our association, but those services are costly. You have to pay for it. But when you are working for some business, you have extended healthcare benefits. You can get your death, you can buy glasses, you can clean your teeth, you read your package, mental health services, to read that if there are mental health services present. Sometimes you have to pay from your pocket, and then the counselor give you a seat, and then you can claim, you will get reimbursement. If you don't have that, and if you can't afford that, so then you can go to community services. They are low cost or free counseling service. There are available in the community health, as I told you earlier. So you have to advocate for yourself, and you have to research, and you will get a service from somewhere. The next two questions are for Dr. Chima. Home is about home remedies. What are the home remedies? Are good? Are they good? The second question is, and the medication, the allopathy and homeopathy. The people who came from India or Pakistan, we are mostly Panjabi. 60, 70 year before, did you hear cancer? Somebody dying with cancer or heart attack? All these things we are doing. Whatever we learned from culture, lentils, garlic, ginger, spices, all those things are very important. So considering all these things, in the Western they modified it, gave new name, our spices. For example, garlic, it blood controls the blood pressure, cholesterol, and anti-inflammatory things. Turmeric is there are capsules, and it will improve your joints. They are very important. Everything in moderation. Second question is also related. If you have heart problem, you are taking aspirin, you are taking turmeric, and your blood will be very thin. Don't hide your medication from your doctor. Tell them, these are the things I'm taking, these are the medication I'm taking. Pay attention. The homeopathic or Ayurvedic medicine doesn't hurt you. No, it will not affect anything. Is for your prevention is very important to maintain your body. The second thing is, people who have less money, people who are in South India or near the coastline where the weather is good, environment is good, they use all these kind of spices. They are very healthy. They don't have heart attack. Their complexion is good. So all these things. So our culture, our civilization, our medication here is acute care medication. You tell your doctor you have heart attack, and you will have a you have an operation, but your dietitian is going to tell you what the things to eat. Before the diet was Mediterranean diet, there were many names here for the diet. The Punjabi diet, spices, all those things are good. And there are fights in the world because of these spices. The spices are very important for you. So take them. Do you agree with me? Yes.
We are all trained. We go to the doctor, family doctor, specialist. They don't have answer for everything. A psychologist, dietitian, talk to them. Somebody who can coach you spiritually. If you go to the church and just pray there, that's not gonna help. Do some yoga, do some deep breathing, hot yoga. Avoid that. Yoga is fine, but sweating excessively, excessive sweating is not good. You just have illusion that's they're taking your money. Sweating is to maintain your body temperature, to keep it cool. So do yoga, do exercises. Spices are important. So, good quality spices. Vineet, anything you want to add? Yes. I just want to say the real medication is your diet. Even in Western medication, or even say in Punjab, the balanced diet is important, the healthy eating. That's best preventative medication. If we bring some balance to it, eat healthy, then we can keep our health healthy. But once you need Western medication, then you should consult your healthcare team. There are many professionals in your healthcare team, and they can give you the best advice what to eat. Based on your medication, they can decrease the side effects of the medication and make it more effective. And we should add that into your diet when you're taking medication. There's so many foods that you should not be eating because they interact with your medication. So if you don't have any illness or disease, then look after your health and eat what's good for you. And if you have a disease, then talk to your medical team. Tell them you're trying these remedies. And the medicine is holistic these days. They can give you advice that according to our science, this is better. That going to eat more or less, or should you eat more or less? The nuts, the lentils. Dr. Chima, three more questions. Then one more Kashmir, then one from Reed. First question: if somebody has excessive breathing, or they're having hard time breathing, is it lungs issue or heart? People who have asthma, they have different issues. But if you have diabetes, cholesterol, and you're having hard time breathing, especially going up the stairs, that's a big sign that you should see your doctor. It's not a minor thing. If you are having hard time breathing, going up the stairs, that's a big thing. Oxygen is not going to your lungs or your to blood. So, it's your lungs that check your heart. And asthma medication, use it properly. Talk to your pharmacist. It's not just you just go and say hello and get the medication. And to use the pumps, how to use the pumps properly, how many times you need to use it, pump or anything else they give you. Second question, I see. Second question is, if you're walking and you have shoulder pain, and if it is going on for 10 minutes, for so many years that you have this problem, should you see your doctor? It's a very simple answer. We should understand the shoulder pain and walking has no connection unless it's on the left side. Move your body, be active, some strengthening exercise there, as they mentioned. You're going to get well. No, you're not going to get well yourself. If somebody is diabetic, their muscles, I'm 70 years old. If I'm not walking, I'm going to get sick. The muscles are not going to move themselves. You need to move it and move your joints. And when you're moving, exercising, it's using sugar. It's a simple things you should pay attention. It's not doctor's job, it's your job. Last question for you. If somebody had a bypass, but their feet are really dry now, again, somebody had a heart problem and they had a bypass, they're diabetic. Do you think it was heart block? The blood goes all over the body and it goes all over down there. The veins, the blood vessels, everything affects it all the way to the heart and to the feet. and other organs, sexual organs. It affects everything. And if somebody has a health problem, had a surgery done, and they're getting swelling, and then they need to control their circulation. When you say go sit at home, don't sit like this. Push your legs up, and then improve your circulation. Lift your legs. Do some massage. Do some exercise. Best exercise you see to push it. Move your legs and move your limbs. Even when sitting, some people sitting and they're saying, give me water, give me food, give me tea. You should get up and, move around and do some circulation. Most of the people who are sitting here, they are fit. I don't see anybody who's that sick, but activity, you need to increase that a little bit. Some people say, Herline, walk, should I walk barefoot or not with shoes? That doesn't mean anything. Walk is walk. The dirt is not going to change anything in your body. Avoid those gimmicks. Thank you. Another question for me, then for Kashmir Vineet. I got a question. Brand name and generic. Is there any difference between some they say brand name generic? Just Altes or some liquids generic mix one. There's no difference. Brand name medications are only the companies that have the packet. There are so many years per packet. They have patent for 10 years. When that patent expires, then other companies can make that medication as well. So usually brand name, generic, it's the same medication. And just to keep the tablet stable, what they put in there, that's a little bit different. But the active medication is the same. Only thing is different, insulin. Insulin, a generic brand name. It's a biosimilar. Biosimilar means the medication, the structure of the medication, if you look at it under a microscope, it's the same. It's the same medication, and it's built the same, but it's not the same. Got it? Good? Thumbs up? Just want to add something. If you go to the pharmacy and go anywhere, doctor wrote it for you, Altes or any other medication, they're very expensive. You can't afford it. You have limited income. You can ask the pharmacist through your family doctor or directly yourself. Register yourself with PharmaCare. Participate. Your medications will be free. We get stuck in there somewhere. And you say the medication is not fine. All the medications, go get it yourself. There's no problem with it. It's the same pharmaceutical company, and sometimes have a 12-year patent in India. They make it. It's just up to you. You feel that it's different, it's cheaper. Cheaper doesn't mean it's not good. Next question for Kashmir. Kashmir, if you talk to anybody about your problems, is that beneficial? If you talk to your heart with somebody, does it help? Well, you know the answer to this question. What happens when we keep everything in our heart, in our mind? We don't talk to anybody, we don't share with anybody. Does it affect us or not? Yes. But as we said earlier, if we have tea with somebody, you talk to somebody, you share with them, I'm like this, how are you? Don't you feel lighter? Don't you think, they listen to you, you heard them, it affects, it helps you. If you take it to the next level, first the counselor, there are no counselor therapists. You just talk to somebody who's close to you. But now, if it is something serious, our friends or relatives are not able to help you, then professionals can help you with that issue, right? but everybody should have a person or two in their life that they can talk openly with. You asked a question, do you need doctor? I forgot to answer. You don't need a doctor's referral for psychologist, psychiatrist, for a counselor, but for psychiatrist, you need doctor's prescription or referral. Last question of the day for you, Vineet. It's a very big question. You said coconut oil is not good. We have been using coconut oil for years. What do you think about coconut oil? The coconut oil, we call it saturated. We consider it saturated fat. The saturated fat is built in your body itself. We don't consider it fat. If we increase saturated fat in our diet, it's gonna go in there, and it's gonna create plaque in your blood. What we call metabolic processes. Your question is: there's some countries, there's some places they've been using coconut oil for years. Even in Punjab, we used to eat a lot of saturated fat, milk, butter, buttermilk. But now our lifestyle here has changed a lot. We don't live in a warm place or hot place, and we don't work as hard. So that's why our saturated fat, we need to decrease it in our diet so that it doesn't go into your body and get stuck there and affects your heart disease. Some people have their coconut oil their whole life and it doesn't affect them, but look at what they did throughout their life and what kind of work they did. I just want to thank all the speakers that you explained everything and answered all the questions so simply and clearly. Now, going forward, there are two more door prizes that are left. So I'll ask you to pull the tickets out, and Herleen will pull out a number. And there are two prizes that are still pending. Last time somebody got a ticket, so please, I'll give you another second or two. If you're ready, you can give me thumbs up. Many people are ready. First one is 470. And from now on, we sow a seed into everybody's mind about knowledge, and they're outside, and there are flower plants on every table outside. And as I said, we give you knowledge today that you can take those plants just like those are outside. Thank you. And I wish to thank our community partners that gave us uh, sport to promote and make it successful. And thank you for media partners as well who improved it and told about this every event, and you could be here. And the presenters outside, the exhibitors, and you went there and you gained the knowledge, and I wish to thank them as well. BC Reno, City of Surrey, Diversity Options, PICS, Richmond Multi Community Services, Self Management BC, South Asian Health Institute, Surrey North Delta Division of Family Practice, and most importantly, the speakers. And I wish to thank them very much from bottom of my heart, Dr. Baldev Singera, Dr. Tarun Sharma, Vineet Kaur, Kashmir-based Dr. Guljar Chima, Harleen Chauhan, Ajay Singh, who gave us, fresh in our mind, Deep Sidhu, and Heart and Stroke Foundation. and translators who some speakers who are learning. Thanks to the interpreters as well, Navdeep Atwal and Pradeep Bains. And from Ministry of Health, Ministry of Partners, and UBC as well, and Ripajit as well, who hosted this event today. Thank you. And first of all, I wish to thank you, all of you who came here and participated and made it us aware about our health and give us wonderful information. You can get all the information, whatever we did today, the recording and everything. We'll put it on our website, www.iconproject.org. If you have borrowed any headsets, please return it at the registration before going. Our next event, and it's about chronic pains, to understand and manage it, will be Dr. Smith Chawla next Saturday, March 16, Guru Nanak Sikh Gurdwaras. And you're most welcome to join us there and attend the workshop there. Thank you. Salutations. Goodbye.